There's this feeling you get as a pet owner. It's this little alarm bell that goes off in your gut when you just know something isn't right with your dog. It's not one big thing, right? It's all these little changes that add up.
And it all starts with that one simple question you ask yourself. Is my dog okay? Maybe you look over, and they're just lying there. The spark just isn't in their eyes. Let me just say, if you're feeling that worry, trust it. It's real and it's important.
Maybe your dog, who's usually tugging on the leash, is suddenly dragging their feet. Or they don't even get up to do that little happy dance when you walk in the door. That kind of sudden, deep tiredness, that's a huge red flag.
And then it can get even more worrying. Their favorite squeaky toy just sits there. And maybe the worst part? They're not even interested in their food. When a dog doesn't want to play or eat, that's when you know something is really, really wrong.
So you decide to check them over. You gently lift their lip, and instead of that nice, healthy pink color, their gums look pale, maybe even white. That's the sign that sends most owners straight to the vet. Okay, let's talk about what this could be. We're going to get to the bottom of it.
All right, so all those things we just talked about, they could be pointing to a condition called Immune-Mediated Hemolytic Anemia. We just call it IMHA for short. And yeah, I know that sounds really complicated and honestly pretty scary, but stick with me. We're going to break it down into something that makes sense. The most important thing to get is that this is the body's own defense system making a big, big mistake.
So what does that actually mean? Well, in the simplest terms, the system that's supposed to protect your dog from things like viruses and bacteria has gotten confused, and it's started to attack your dog's own body. To really make this click, let's use an analogy.
Okay, so imagine your dog's immune system is like a super smart security team for their body. Its only job is to spot bad guys, like germs and viruses, and get rid of them. But with IMHA, something goes wrong. The security team gets confused. It looks at the body's own red blood cells, the really important ones that carry oxygen everywhere, and it mistakes them for invaders. And it launches an all-out attack. It's literally friendly fire, but it's happening inside your dog.
So the first question everyone asks is, why? Why on earth would the body's own security team do this? And you know what? That's the million-dollar question. And the answer, well, it's not always straightforward.
This is probably the most frustrating part for everyone, for owners and for us vets too. In about 3/4 of all cases, it's what we call primary IMHA. Primary is just a fancy way of saying we don't actually know why it happened. The immune system just went rogue. Then for the other quarter of cases, it's called secondary IMHA, and that means something else kicked it off, something triggered the attack.
So what kind of triggers are we talking about? Well, sometimes it can be an underlying issue like cancer or even certain infections. Genetics definitely can play a part. Some breeds, like Cocker Spaniels and Poodles, for instance, just seem to be more at risk. But the tough truth is, for most dogs who get this, we never find a specific reason. The cause just remains a mystery.
Okay, so this all comes back to you, because knowing what to look for is the single most powerful tool you have. Seriously, what you see at home is so important, because catching this early can change everything. Let's go through what you should be watching for.
We've already mentioned a few of these, but let's put it all together. You've got the pale gums, that's a classic sign. The extreme tiredness, that's from the lack of oxygen. They might be breathing really fast even when they're resting. That's their body trying to compensate. You might even notice their urine is a really dark color, almost brown. If you are seeing any combination of these things, please trust your gut. Don't wait. It's time to call your vet.
And I get it. Rushing to the vet, especially for an emergency, is one of the scariest things an owner can go through. You're worried, you feel helpless, but I find that knowing what's going to happen can really help with that anxiety. So let's just walk through what you can expect so you feel a little more prepared.
First things first, your story is everything. Tell the vet exactly what you've been seeing at home. You know your dog better than anyone. After that, we'll run some key blood tests. That will tell us if your dog is anemic for sure. We'll also look at a drop of their blood under a microscope. We're looking for little clues, like red blood cells that are clumping together or that look like tiny little spheres instead of their normal donut shape. These are the telltale signs that an attack is happening. And finally, we might suggest an X-ray or an ultrasound, just to hunt for any of those triggers we mentioned earlier.
So if the diagnosis is IMHA, treatment needs to start right away. And we have 3 main goals. Goal number 1, stop the attack. We do this with medications, usually steroids, that basically tell that overactive immune system to stand down. Goal number 2, prevent complications. This one's a biggie.
IMHA makes the blood cells sticky, which means there's a really high risk of blood clots, so we almost always use anti-clotting meds. And goal number 3, support the body. This might mean hospitalization with IV fluids or even a blood transfusion to help stabilize your dog while the other medicines start to work.
Okay, now we have to talk about the toughest part, which is the prognosis. And I want to be really honest with you. This is a very, very serious disease. The path forward really depends on how a dog gets through those first critical days.
So, I'm just going to be direct. The initial crisis is incredibly dangerous. For dogs that are sick enough to be in the hospital, the survival rate is about 50%. I know, that's a terrifying number to hear.
But, and this is a really important but, if a dog can make it through that initial phase, their long-term chances get so much better. The fight is really front-loaded. Getting through those first couple of weeks is the biggest hurdle, by far. Look, the first few weeks are absolutely the hardest, but so many dogs go on to live long, happy, wonderful lives. It just takes careful management and working closely with your vet. A full recovery is possible. So if there's just one thing you take away from all this, please let it be this. Early detection and aggressive treatment are everything. If you see those signs we talked about, please contact your vet right away. You are your dog's biggest advocate, and acting fast gives them the very best chance. Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.